of my questions is, what would you say to someone looking for help with their mental health who doesn't know where to start?
So I think the first thing, and I'm gonna send you a guide for this, because I think the first thing is I always ask people to rate their stress from 0 to 10. So 0 means no stress at all. And I done a meter like with like cartoons. So 0 stress at all is like what my cat has. Like my cat doesn't pay rent. He doesn't care about who's president. He's just like, cool. So 0 stress is actually not very helpful, because if you have 0 stress as a medical student, you're not even gonna study, right? Like, what would you? No, you're just gonna be hanging out at home. So you need a little bit of a stress to actually get stuff done. Ideally, you want to keep it like 1 to like 2, 3 every day, and you're cool. So that's normal. The idea with therapy is never to eliminate all the stress. It's to actually keep you at a reasonable, manageable level. When we get to 4, that's when things start to like get more difficult. And in 5, 6, increasing to that up to 10, which is the time when you feel like you're about to harm yourself or do something harmful to yourself or others. So depending on where you're at in that scale, I recommend different things. If you have been thinking about harming yourself or another person, or doing something that could be harmful to your career, yourself, could be like using drugs or dropping out of school, things like that. If you're at that level, like in a crisis, I do have a specific skills for that can get you out of that crisis pretty quickly, actually. So, and then I also, if that doesn't work, I do have a videos that promotes, I call it the crisis survival skills. And then I also have resources, so international resources for suicide prevention crisis lines. If you are at so between 7 or more, I start recommending grounding skills of high intensity. So I have a video that shows what to do in those cases. And that's what we would use at the psychiatric hospital to get people out of pretty severe panic attacks, crisis too, just moments when people feel like they are lost, they can't think clearly. And then I have, grounding skills for like when the stress is 5 or more, and when it's 4 or more, it's just like more, it's just everyday type of grounding skills, breathing skills. Yeah, it's just therapeutic skills that can help you go with like day-to-day stress. Then I also talk a lot about like coming up with a whole plan of how to live a better life altogether and reduce the vulnerability factors. So reduce the chances that if you were to face a crisis, you will engage in a very problematic behavior. So I'll explain, because it's really long, but like I'll explain the guide after, when I'll send it to you. But that's pretty much, some of the basic guidance that I give to people. And then ideally, if people have the opportunity, the thing is like, it would be great to say like, just go and get therapy. And I hope a lot of people can do that. But the reality is that there are like very long wait lists oftentimes. There are barriers in terms of people, lacking health insurance, lacking transportation, not having enough time, stigma and everything else. So I think that besides saying like go to therapy, we need to give other type of approaches, I guess. So that's what I will send to you. Thank you for the question.
Jonathan, do you have a question?
Thank you, Dr. Espinola, for presenting to us. I wanted to ask you more about your advocacy work.
Yes.
So you said that you had a lot of success in Florida. I was wondering, how has your experience been in Ohio? What have been some of the unique challenges you faced here? And are there any different strategies that you're putting into play here to try and achieve the same level of success that you saw in Florida?
Yeah, I think politically it's actually similar, because there's both swing states. So I think in that regard, what I found is that you do have to, no matter what you're trying to promote, you always want to keep in mind that you're going to need bipartisan support. Like, so you need to like expand the ways in which you explain. So first of all, like to actually do research on the issue that you want to promote, you know, look at everything that has been studied in that regard, and then try different approaches and have all your tools available to you when you're speaking to representatives or proposing a change. So one of the tools could be, like I said, like, you know, those type of stories that really touch people. Other one is to show like research, right? Other one is like, how this change that I'm proposing will impact the economy in a positive way. So that takes a lot of time sometimes, but if you build up the right connections, you will find enough people who are already doing some of that, and you can collaborate. That's the other point with public policy. You can do things on your own. So the US is an individualistic country, so we tend to think about like, you know, just thinking very into what you can do as an individual, and that is limited always. So you want to think like, who else is thinking similarly to me, and can we collaborate and come together as a coalition, right? Another important point when it comes to public policy is that you want to, you cannot speak on behalf of the University of Cincinnati, right? You have to, well, you could, but you have to talk to government relations first. So that would be, so if you ever want to do that, you always want to talk to them first and make sure that the university actually supports what you're proposing. I have spoken on behalf of myself sometimes, but mainly in association with other organizations. So the American Psychological Association, the Ohio Psychological Association. So you want to look about what organizations are already like supporting this, and then you join them. Make sense? Okay. Thank you.
All right, so if we don't have any more questions, I'm gonna go ahead and throw a discussion prompt so we can all try to reflect on what we learned in the chat. And then Adam is going to introduce our next speaker. And thank you so much, Dr. Espinola. We loved having you. And I can't wait to check out your YouTube channel.
Thank you. Thank you, guys.
Thank you.
Have a great day.
You too.